All right, welcome to Unit 3, the nursing process in care planning. So today we're going to talk about a very important and core pretty much to what you are going to be doing as a nurse. So the nursing process is the basis of everything that we do as a nurse. It encompasses everything that you will do from the second you meet your patient to even beforehand to the second your patient leaves the floor. So, really understanding each component of the nursing process and what your role is in each one is going to be something that you incorporate into every single interaction with your patients and every single day as a nurse. So there are different roles of the LPN versus the RN in the nursing process, and I will initiate them as we go through it. Right. So the 5 steps of the nursing process are assessment, diagnosis, planning, implementation, and evaluation. So when we will break down each of these components, um, but if you look at it as a process, right, it's the nursing process, it's what you do as a whole. So one of these will not work alone. We need to be doing all of them together in this process. And it's going to continue a cycle, as the slide before shows, that as you go from assessment to diagnosis to planning to implementation to evaluation, and then we go back up to assessment. So we're going to continuously be doing these things all the time. Um, and do you think you only assess your patients once? Right? So this a continuous assessment is then going to influence the cycle. So every single time you assess your patient, that then could affect your diagnoses, your planning, your implementation, and your evaluation. Right? So this is a constant cycle that's always moving and always flowing. And this process is really how we put it all together. So if you think of the term process, right? When you think of what you do, anything that requires processing or moving, right? It's going to be that it takes time, it takes effort, it takes critical thinking and all of those things to get through it, all right? So it's not something that you're just going to do instantaneously. It's something that we need to work fluently through, all right? So, nursing process. Let's start with first, number one. It's going to be the assessment. So, step one, we need to assess our patient. So, when do you think you do assessing? Do you think it's when you first meet your patient? Maybe when you walk in and you say, okay, I'm going to do an assessment on you now, right? So every single time you interact with your patient, you are going to be assessing them. So you walk into a room to give them a Kleenex box that they asked you for, you are going to be doing assessing at that time. You're visually looking at them. You're smelling when you walk into the room. You're hearing what they're saying. You're hearing what they sound like, their cough, their voice change, right? So you are assessing every single time you see your patient. So the focus is to gather information and collect data. Okay, so that's our primary goal in an assessment. It is data collection. Right? So we need to get all the information as much as we can about our patients. All right, so we are going to have different tools clearly of how we are going to do this. We will talk about a physical assessment and all of that, but there's much more to that as well as we're collecting data. Okay, so the type of sources that we have are our primary source, which is our patient. Um, and that is who we want to get all of the information from, is our patient. That's the best way. Family is on here as well, due to if our patient cannot communicate, that family member would be becoming that primary source in a pediatric situation, right? So the primary source is going to be that caregiver that was there with them, seeing their symptoms, so on and so forth, right? So that's going to be your primary source. Secondary is going to be the actual exam that you're doing, nursing history, team members, lab reports, diagnostic tests, everything else. Okay, so there's a whole lot of other secondary sources, anything besides the patient and or family member. If I have a patient that can communicate clearly and fluently, who is a better source, them or the family member? It's going to be the patient, correct? All right, so subjective versus objective data, we are going to get into that very well in the following slides. Just know subjective is the symptoms from the client, and objective are those observable data or the signs. That'll make a little more sense going forward. All right, so data collection. So, like I was saying, that though using all of your senses, touch, sight, hearing, smell, and taste, those are the cues, right? They cue you into looking further. So if I walk into a room, I smell something that just smells off. That is cueing me to look and investigate further, to look for more data, to pull in more information, right? So I may need to look at my patient, open up the wound, see what the wound looks like. Possibly there's vomit in the room that I didn't know about, right? So that it's going to cue me to look further. And you're going to use all five of your senses to do that. The other concept here is inference. So if I need to infer something, where does that all come from, right? So it's what I read, what I know, and then what I infer, right? So information that you already know, what you already have knowledge of, and that you have seen and read, and then we can infer what we think that information it means, right? So I take in these cues that tell me what's going on. I can then infer that something more is happening, but what do I have to do? Is continue to data collect to support that concept, right? So I smelled something that smelled funky. It kind of smells like an infection. So then I'm going to, what I know is that that smell smells like that. I'm going to look further, and then I find a wound that looks green and oozy. I'm going to infer that that is an infection, right? So you're going to bring in all that information together. So types of data collection, subjective versus objective. This is going to be key in success is understanding the difference between subjective and objective. So subjective is information only perceived by the affected person, verbal statements that describe symptoms or feelings. So this is itching, pain, feelings of worry, all that good stuff, right? Verbal statements that describe symptoms or feeling. So I feel itchy, I feel worried. Uh, Objective is going to be observed or avert data. So observable and measurable that can be seen, heard, smelled, or felt by someone other than the person experiencing them. Blood pressure, right? That's a clear, straight data right from the patient. Shortness of breath. I am visually seeing that that patient is short of breath, right? If I get in report that the patient is saying that they are short of breath, is that subjective or objective? That's going to be subjective because it's only known, perceived by the affected person, verbal statements that describe the symptoms or the feeling, right? So I is not objective. I did not see it, okay? Um, so we are going to practice a subjective, objective very much. So get those basic concepts in so we can practice. So what we need to do with this assessment and data collection is we need to validate, we need to cluster, we need to analyze, compare, and make a reasoned finalization of what all this information means. Okay, so I've collected it all, I brought it together. Now what am I going to do with it, right? Um, so key of what can an RN do versus what can an LPN do. So we can collect data, um, but we cannot officially diagnose a patient. Okay, so the next step that we're going to go into, we collect all the data, we get all that information. We need to now put that all together to make a nursing diagnosis. Okay, so the nursing diagnosis, we've collected all of our data, we've brought it all together. Now, what can we do with that data? What have we figured out from that data? All right, so there's key element that we need to understand is going to be the difference between a nursing diagnosis versus a medical diagnosis. So NANDA is a North American Nursing Diagnosis Association has these standard diagnoses that we will look at, right? So 235 different diagnoses, 13 different domains, 47 different classes to kind of break them all down to see where they fall. They fall within different areas of sorry about that. They fall for different areas of at risk for actual. So these are going to be the response to an existing condition, and then wellness. So these are ones that they're describing a readiness for improved or optimal health. Right. So we will look at lots of different examples of these to better understand them. Know that they fall under different categories. So the nursing diagnosis has three different main factors to it. So, what that diagnosis is. So, the diagnosis with a description, impaired, altered, or delayed, that sets it up. And then after that, it's going to be related to. So, what is causing it? And this should not include the medical diagnosis that's causing it. It should include a biological, a mental, pathophysiological, a situational treatment. Um, Oftentimes, is you're describing a symptom of what that medical diagnosis has caused, is going to be in that related factor. The manifestation is going to be the symptom supporting the evidence that is stated in the as evidenced by. All right. So you will sometimes hear, the nursing diagnosis related to, loss of family, and then manifested by or as evidenced by. Right. So the as evidenced by or manifested by are you'll see that interchanged. Okay. So now we have done A. We did our assessment. We got in all that data, we brought it all in. Then we got a nursing diagnosis. So let's say we did all of our assessment. We find out that the patient is not eating well, right? So that they're just not taking enough food in. So then our priority nursing diagnosis is imbalanced nutrition, less than body requirements. Now we are going to put a plan into place to make sure that we are hitting those each elements of our nursing diagnosis. Okay. In our plan, we're going to identification of our diagnosis, right? So we know that our diagnosis is. Now we're going to set patient-centered goals and outcomes. So these goals and outcomes are going to have to be specific to our patient and prescribe nursing interventions. So these interventions are going to get into place. So put all this planning together to make sure that our patient is taken care of. We'll need to set priorities. Most important problem first, life-threatening or impacting clients the most is going to be clearly our number one. All right, outcomes are patient-centered and SMART. SMART meaning specific, measurable, attainable, relevant, and time-bound. Specific to my patient. That is going to be key that we always have to go back to. The whole purpose of a nursing care plan and using this nursing process is that it's specific to our patient, that it's helping our patient, and it's not going to be a generic interventions and plan and everything in place. So because we want our patients to be, they're very, very different and unique. And if we're looking at a holistic view, we need to make sure we're doing that. All right. So, and then measurable, attainable. Can my patient actually do it? Do it. Relevant. So it's still needed to be happening, and time bound. So sometimes we have these interventions in place that just don't make sense anymore. All right. So a goal or an outcome here is going to be patient will walk 50 feet, TID, meaning 3 times a day, beginning today. So that outcome that we want is that the patient will walk. If I just said patient will walk, is that telling me anything? So it's going to tell me how far, how often, and when we're going to start it, right? Um, Patient will eat 75% of each meal by 9/1/17. It's giving me the end date. It's giving me the overall amount and how often. So it's going to be at each meal. All right. So planning, developing a goal and outcome statement. So our nursing diagnosis. we know is risk for infections related to recent surgical procedure. All right, so a risk for infection related to recent surgical procedure. You'll also have on here is going to be as evidenced by um, when you have other ones. But these risk for infections, we'll talk further. The risk for, uh, you don't usually have your evidence. So a goal is patient will remain free from infection, right? That's your overall goal. That is my purpose. It connects directly to my nursing diagnosis that they have a risk for infection. My goal is they will not have any infection. Outcome is where you're going to see all those smart elements, right? So patient will not exhibit any signs of infection, which include redness, pain, drainage, and warmth at surgical incision site for length of stay. So that length of stay is telling me how long, and then my descriptive is what we're looking for. All right. So now that we have put that plan in place of what we're trying to obtain, we're going to now implement these steps. So implementation is what we're talking about with the doing. So implementation is how you're going to implement that plan into place, into actually doing things for a patient. So that implementation process is your interventions. So what you're going to actually do for your patient. It could be initiated by the nurse, it could be initiated by the physician, or it could be collaboratively by the whole care plan team, healthcare team. All right, that could mean physical therapy, that could mean social work, that could mean OT. So this is our actual intervention, implementation, or the doing. So you may be monitoring vital signs. You may putting in a certain diet. You may be teaching. This is where you want to get creative, right? This is where it's going to be really patient specific, making sure that they are getting those goals met and are they attainable, right? Always going back to that. Whenever you're writing your care plan, you're going through this process, you want to make sure that you are matching your interventions are going to help you meet your goal that will then fix your nursing diagnosis, right? Or help that nursing diagnosis. So you always, whenever you're doing one of these, make sure it goes back and it connects. Finally, after you do all of that, you assess your patient, you create a nursing diagnosis, you make a plan, right? You put that all together, your goals and your outcomes. Then you're going to implement through your interventions. And finally, after I do something, should I do afterwards? Did it work? Right? So we're going to actually evaluate, did everything that I just put into place work? Right? So factors that impede goal attainment so that for some reason it didn't work, right? So incomplete database, unrealistic client outcomes. So that goal I put in place wasn't realistic. My patient could not walk 50 feet 3 times a day, right? Non-specific nursing interventions. So there wasn't, those interventions were not, I didn't say will walk so far at this amount of time, right? You need to be specific to your patient to make sure they're attainable, right? Inadequate time for client to achieve the outcomes. So there's a variety of reasons clearly that could impede your patient from getting to that goal, or it could just be they couldn't do it. So now we need to reevaluate and go back to the beginning. All right. So if you go to that evaluation and they are not attaining it, let's go back, reassess, and start all over again and see what can we do to meet. Can we get a more attainable goal? Maybe we need to reassess because um, they got worse, right? Things started to go down the drain a little bit, right? But if they did get the goal, they did meet. You evaluate and they did great. Perfect. You move on, and you said that goal was met, and we're going to move on to the next one on our priority list. So care planning. This is going to be this whole process that we just put together. Um, The reason for care planning, sorry, this slide looks a little funky, is necessary for communication. So from patient to patient to patient, from provider to provider, we're able to look through and see what everybody else is working on, right? So if I know that the nurse prior to was working on this and their evaluation was this, then I can then go off of it, right? It's kind of like a universal language that we all can use. Joint commissions requires it. It's a regulatory body through the hospital in medical settings. helps to ensure this quality of care that we're all doing the same thing, right? We want to be working in the same way. Maybe linked to reimbursement. So some money, some insurances and things like that will only reimburse for certain nursing diagnoses that were met through that, or requirements for physical therapy and things like that. All right. So this little form here is something you will get very familiar with. So this is your care plan form. So the care plan puts in that whole care nursing process. So if you look on the top, it's going to have your subjective and objective data. That is your assessment data collection. Next, your nursing diagnosis, which is your diagnoses. Planning is going to be our goal and our outcomes. Interventions are your interventions or your implementation. And then evaluation. That category that doesn't have anything in it is going to be your scientific principles of nursing interventions, meaning how do I know that that intervention you just put into place is going to work for my diagnoses? How would you know? You're going to have a care plan book that will tell you all of this. It's anywhere that you found information that supports that intervention. Your textbook is going to be a great resource for putting that in. And that category will all be in APA format. And so, a medical diagnosis is within the scope of a medical practice. So it refers to the disease process. This is probably what you're very much more familiar with prior to coming to nursing school. So these are going to be medical diagnoses. So focusing on treating and healing an underlying pathology. So this stays the same the whole time, the whole disease process, right? Um, Diabetes, so that you have a heart attack. All of these are going to fall under a medical diagnosis. What a nursing diagnosis is going to treat the problem within the nursing scope of practice, identifies responses to health and illness, directive of nursing interventions, and can change from day to day. What a nursing diagnosis is basically what the nurse is focusing on as a priority in that patient. We talk a lot about what the role of the nurse is and what the difference between the nurse and with the rest of the healthcare team. And the nursing diagnosis is really the core to all of that, and the nursing process is the core to the difference between a nurse and another medical provider, right? The way that we look at our patients is through these nursing diagnoses that allow us to see the patient as a whole, right? This holistic approach to our patient, that it's not that they are just a diabetic patient, that there's so much more about our patients that we need to focus on and to treat in order to treat that medical diagnosis, right? And in order to make sure our patient is well rounded and taken care of to get to that final solution of healing them in all aspects of their body, not just that medical process. So that's why these can change from day to day. And this is where we're going to have to use our hierarchy of needs, that Maslow, right, to really see what is a priority for them. So our patient can have tens and twenties of nursing diagnoses, but you really want to focus down to the ones that are core to getting them to improve and to move on. Okay? So this is it's a process, and we will work a lot on understanding what this nursing diagnosis is.